My name is Danica Swan, and this is my genetic disease presentation on Huntington's disease. Huntington's disease is an autosomal dominant inheritance, meaning only one copy of the altered gene in each cell is sufficient to cause the disorder. A parent with a non-typical copy can either pass a non-typical gene or a healthy gene to their child, which making it a 50% chance of a child inheriting the gene. The gene that is affected by Huntington's is the HTT gene. Huntington's is caused by mutation in the HTT gene. The HTT gene provides instructions for making a protein called Huntington. This protein plays an important role in brain cells. The HTT mutation affects the CAG trinucleotide repeat, and this gene repeats itself, but if it repeats too many times, you are more likely to develop the disorder. People who have a CAG repeat of 40 or more always develop the disorder. Huntington's usually cause movement, cognitive, and psychological impairments. Um, Symptoms appear first, varies from person to person. The movement disorders associated with the disease can include involuntary jerking, speech, swallowing difficulties, unusual eye movements, impaired posture and balance. Cognitive impairments include difficulty focusing, learning difficulties, lack of impulse control, lack of behavior awareness, and psychological impairments can include social withdrawal, insomnia, energy loss, suicidal thoughts, and irritability. The psychological impairments usually lead to depression. That is the most common psychiatric disorder associated with Huntington's. And other psychiatric disorders are obsessive compulsive disorder, mania, and bipolar disorder. A preliminary diagnosis of Huntington's disease is based primarily on your answers to questions, a general physical exam, a review of your family medical history, and neurological and physical examinations. Some of these tests can include brain imaging and functioning tests, and this is to assess the structure of your brain, genetic counseling and genetic testing, and this would be for testing for the non-typical gene, and predictive genetic testing. It's just testing for the gene in your family history if you don't have any symptoms. Other tests include neural exams, which tests your motor skills, sensory skills, psychiatric thinking, a neuropsych exam, which tests your memory, reason, and language, and your psych exam, which tests your emotional state, mental disorder, and behavior patterns. Men and women of all racial and ethnic backgrounds can be affected by Huntington's, but the prevalence of the illness differs between people. It affects 3 to 7 per 100,000 people with a background from Western Europe. Um, it is less common in Japanese, Chinese, and African descent people. It is the highest rate of Huntington's disease is in Venezuela, in a remote town called Lake Maracaibo, and it has the most cases of Huntington's. Huntington's disease affects between the ages of 30 and 50. Huntington's has no cure. There are many things that help, such as medications and therapies, movement drugs, antidepressants, antipsychotic drugs, mood stabilizing drugs, psychotherapy, speech therapy, physical therapy, and occupational therapy. After Huntington's disease starts, a person's functional abilities gradually worsen over time. The rate of the disease and progression varies. The time from the first symptoms to death is often 10 to 30 years. Eventually, a person with Huntington's disease will require daily help with activities and care. Late in the disease, the person might be confined to a bed, unable to speak or recognize people, but they do understand language and are aware of family. Common causes of death include pneumonia or other infections, injuries related to falls, complications related to inability in swallowing.